how often should someone have a colonoscopy?
In general, guidelines for colonoscopy risk suggest a colonoscopy anywhere between once every 3 to 4 years to once every 10 years, depending on a person's risk for colon cancer. For example, if someone has no family history of colon cancer and is about age 50, it's currently felt that a colonoscopy at 10-year intervals is considered to be adequate. If someone has had abnormal tissue polyps or adenomas in the colon previously, every 5 years may be more appropriate. Your doctor can help you choose and find the level of risk that you may have and choose an appropriate timing for a colonoscopy. If someone has had colon cancer in the past, typically a colonoscopy is done at a 1-year interval following the colon cancer removal, and then at a 3rd year, and then at 5-year intervals thereafter, assuming that large polyps are not also found on each of those exams. Again, these are all adjusted to risk of colon cancer, how many polyps, how large the polyps are.
What if one of your family members has had colon cancer?
Well, certainly a person's risk for colon cancer increases, especially as the number of people within his family have had colon polyps or cancer, and especially if they've had it at a particularly young age. In general, we suggest doing the first colonoscopy at an age 10 years younger than the person that developed colon cancer in your family. For example, if I had a brother with colon cancer, I should have a colonoscopy typically 10 years earlier than he developed that colon cancer, again to reduce my risk. As we get relatives farther and farther away, the risk obviously decreases. For example, someone whose brother had colon cancer would have a much higher risk than someone whose great aunt had colon cancer.